Hi everyone, my name is Angie and I will be talking to you today about diabetes. Before we get started, I'm going to share with you some facts about diabetes. Diabetes is estimated to affect more than 382 million people worldwide. 10% of all those suffering from diabetes experience type 1 diabetes, which means that their body is not producing any insulin, while 90% of those affected by diabetes experience type 2 diabetes, which means that their body's insulin production is not enough to absorb all the extra glucose in the blood. So what is diabetes? Diabetes, also known as diabetes mellitus, is a metabolic disease that happens as a result of high blood sugar due to low insulin production, or the body is unable to respond to the insulin properly. There are three types of diabetes that I will talk about today: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes happens when the pancreas doesn't produce any insulin. Most often, type 1 diabetes is diagnosed during childhood. However, sometimes young adults get diagnosed with diabetes type 1 as well. Until today, science has been unable to find the exact cause behind the development of type 1 diabetes. However, majority of those with type 1 diabetes develop the disease when their immune system mistakenly attacks islet, which is the cells that produce insulin in the pancreas. This is a summary of how insulin works. The pancreas, which lies just behind and below our stomach, disposes insulin into the bloodstream, where it helps glucose enter our cells. This is a very important function because it decreases the level of glucose in our bloodstream. Once our sugar level drops, so does the disposal of insulin from the pancreas. Those affected by the diabetes type 1 are at risk of life-threatening sicknesses because glucose can build up in their bloodstream due to the lack of insulin. This leads us to our discussion of some of the health complications that can affect those diagnosed with type 1 diabetes. First, one can suffer from nerve damage, also known as neuropathy. Because there is excess glucose in the bloodstream, they can end up injuring the walls of their capillaries. Thus, what might start as feelings of numbness or burning at the tip of their toes or fingers can soon spread and cause them to lose their ability to feel the affected limbs. Second, those with diabetes type 1 can suffer from kidney damage, also known as nephropathy. Because the kidney contains many clusters of blood vessels, the excess in glucose could damage the filters in those blood vessels, which will lead to kidney failure or end-stage kidney disease. And last but not least, they can experience heart and blood vessel diseases, such as atherosclerosis, which happens when the size of the blood vessels narrow due to the build of plaque. So what are the symptoms of type 1 diabetes? Some of the symptoms include frequent urination, extreme hunger and weight loss, as well as fatigue and blurred vision. For women, they can develop yeast infection as well. While there is no cure for type 1 diabetes, there are some ways in which one can go about maintain a normal sugar level in the blood. Such methods include taking insulin through injection or by taking medications such as spermilintide, which is taken right before eating in order to slow the digestive movement of food, so it gives sugar more time to be processed. Type 2 diabetes happens when the body stops responding to the insulin, or when the pancreas decreases the amount of insulin production. Referring back to the process explained earlier, when there is a high level of sugar in the blood, the body's beta cells in the pancreas produces insulin. However, those who are suffering from type 2 diabetes are unable to respond to the insulin production. The beta cells eventually loses its ability to produce enough insulin. As a result, sugar builds up in the blood vessels. The rise in those affected by type 2 diabetes can be explained by the increase in obesity. The bodies of those who are overweight are more likely to stop responding to insulin due to the excessive fat tissues. In addition, if the body stores fat primarily in the abdomen, then their chance of getting type 2 diabetes also increase. The health complications that can result from diabetes 2 are almost the same as those from diabetes 1, with the addition of Alzheimer's disease. However, the connection between Alzheimer's disease and diabetes type 2 has not been scientifically proven. One of the proven methods of decreasing one's chance of developing type 2 diabetes is to stay healthy and fit. Finally, the last topic I'm going to talk about is gestational diabetes. Gestational diabetes develops during the last half of pregnancy. During pregnancy, the mother's pancreas produces insulin, but the placenta also produces many other hormones that decrease the effect of insulin. Thus, pregnant women often experience a high level of blood sugar. As the pregnancy progresses, so does the increase in hormones that the placenta produces, that blocks insulin from performing its job. Therefore, gestational diabetes happen when the placenta's insulin-blocking hormones have caused the level of blood sugar to surpass the healthy levels. However, after the 20th week of pregnancy, if a woman has not developed gestational diabetes, there is no chance that she will develop it. Women who experience pregnancy after the age of 25 are at higher risk of developing gestational diabetes, and so are women who are overweight. Thus, the best way to prevent yourself from developing gestational diabetes is to eat healthy and exercise. This brings us to the end of my presentation. I hope you benefited from the information provided in this presentation. Thank you.